Hello everybody, it's the infant feeding team. It's Thursday and we are the infant feeding team at the John Radcliffe Hospital in Oxford, and we have got our session on infant feeding. It's for 1 hour, although we always go over because we've got so many fabulous questions from you and we talk too much. And anything to do with infant feeding today. So if you are giving your babies bottles, if you're giving your babies express breast milk, if you're giving your babies formula, if you're breastfeeding, any of those things, if you're pregnant, if you're not pregnant, you know, and you just want to ask questions for a friend and you're watching, then do post your questions, and the more silly the better. And somebody else will be thinking about that silly question if that's what you think it is. So somebody else will be wanting to know the same answer as you're asking. So they're always valuable, always very, very interesting questions that always lead to plenty of chatter. So please do send your questions in. Say hi, and do you know what? We don't know where you're from, so some of you just say hi and tell us which part of the country you're in, because I have heard that some people are in Devon, I have heard some people are in Jersey, some are overseas in Australia, and where was the other one we had?
China. We've got a colleague in China.
A colleague in China. So let us know where you are and just say hi from wherever, because it's, you know, I'm sure that not everyone in Oxfordshire is, everyone is from Oxfordshire in this forum, because lots of people have told their friends about us, which is absolutely fantastic. So, and you're welcome to ask questions even if you're not from Oxfordshire, obviously. So this forum is not for midwifery questions in terms of where the scan appointments are, or anything about visitors or labour or anything to do with your pregnancy, unless it's breastfeeding or infant feeding related. They are for a different forum, so you can join Ask the Midwife sessions. I think there's alternate Mondays now, aren't they? And also from some of the MLUs, the staff do Ask the Midwife sessions there as well. So
I'm just giggling because you've got your first response.
Oh, where are you from? Where are you from?
Louise. She goes, hello, I'm Louise, and I'm from Brackley. Not too exotic.
Good old Oxfordshire for us. Well, not quite, but nearly. It's Oxfordshire Midwives, isn't it?
No.
So if you have questions that aren't related to infant feeding, please leave them for another forum, because we are midwives, but we might not know the latest answer, because things are moving on all the time in this hospital with the pandemic and everything. We are, you know, things are changing. I think we're a little bit more stable at the moment, so hopefully we're, you know, on the homeward bound, but you know, we're busy here still, and you know, stay safe and protect the NHS, as they say. So any questions at all, really do direct them in our direction. We'd love to answer them.
There's lots of people already watching because the numbers going up.
We were going to talk today again about the 4 allowable signs of milk transfer. So we can't talk about this enough. It's about you as parents being proactive and recognising that your baby is not getting enough milk.
If they're not getting
your baby's not getting
lots
enough
of them
milk.
will be. But
So
it's
we
just...
will also talk about the fact that your baby is getting enough milk, and that's more reassuring. But if you're worried about anything, that's your go-to and your checklist. And I think that's very important that everybody knows that. So I'm just going to get a care plan out as well, so I can go through the care plan.
Charlotte, one of our very, very regular listeners, she comes on every time, she's telling us that she's from Fritwell, so she's an Oxfordshire lady as well.
Lovely.
And her lovely Alicia, who's been watching us, been joining us on these sessions for months, is let me just see what the latest update about Alicia is. She's loving her food, more teeth. It's amazing. This baby's, I feel like this baby's grown with us on this session.
I know.
So congratulations, Charlotte. You're doing a great job. Well, another Charlotte. She's due in 5 weeks. She's pre-packed, pre-made Karen Gate starter bottles in her hospital bag. Is this okay? I'd like to do bottle formula and breast if I can once the baby is born. Absolutely, it's your choice, Charlotte, but we do have it here, and that is one that we can provide you with. So you don't have to bring it with you if you don't want to. I think we've said this
Save it for later.
So you could leave that at home. We will make sure that you've got milk available for your baby, so don't worry about that. I think you're going to talk a bit about 4 allowable signs, and then we'll crack on with some of the other questions.
You know, it's about knowing when your baby's getting enough, and from the very early days, you know, the signs change every day in certainly the first 10 days. So you might talk about getting conflicting advice from the staff, but actually on day 0, Your baby might feed 3 times in 24 hours. It might feed a lot more, but you know, we expect it to feed at least 3 times in the first 24 hours of its birthday. And then day 1 it would start to feed sort of 8 times in 24 hours and onwards. But actually the volumes and things go up. So it might just be, you know, that if you're breastfeeding, you don't know how much your baby's getting. And we assume everybody that is breastfeeding, their babies are getting colostrum and things. But if your baby's not attaching and you're hand expressing and giving colostrum in a syringe, which is what many mums do in the early days when their babies are a bit sleepy, these syringes, and they've got little signs on them which says 0.1, 0.2, 0.3, etc. up to 1 ml. So they're tiny, tiny, tiny amounts, and most people just get about 0.1 when they're doing hand expressing. They don't fill a syringe up usually. Some people do, but most people get tiny, tiny little beads on the end of their nipples when they start hand expressing. And your baby is adapting to being outside of the world, and it is protecting itself with its layer of fat on it, but also you know, knowing that your baby is getting enough is reassuring for you. So in the first few days they start to wake up and feed a little bit more, but how do you know if they're getting enough? So the first sign that your baby is getting enough milk is the suckling and swallowing pattern. And if your baby isn't doing that well, then your baby won't be transferring milk, and that's the first thing that you need to be looking at. So if you can't see your baby suckling and swallowing, you need to be on it, and you need to perhaps talk to somebody. So we know that the suckling and swallowing is, I'm running out of space here.
Which we don't want.
So the suckling and
swallowing
is where your baby's attached to the breast, and it's deep glug, deep glug, deep glug, pause, deep glug, deep glug, and you see the side of the mouth moving, and you see the ears wiggling, and there's a nice big long deep glug. The jaw is really working firmly, the jaw is right underneath the breast, and the baby is swallowing. And it might be in the colostral phase when you've just got colostrum, you know, a few suckles you hear, but it's a k noise, so you're hearing that swallowing, and that's indicating that your baby is transferring milk from inside your breast into its tummy, and that's really important. And they feed frequently, and short, frequent feeds. And as that goes on in the first sort of 48 hours, they will feed more frantically as they're chasing the milk and waiting for the milk to come in, which we would expect to arrive by the end of day 3. But it can be up to day 5. You know, they've got quite a good resilience to that, but actually, you know, they'll be very ready for milk by day 5, certainly. Mostly they get it before that, and sometimes a little bit before if you fed a baby quite recently. But it's the suckling and swallowing that there's the first reliable sign. That tells you your baby is getting enough. And you've got to be vigilant, listening and watching to make sure that your baby is getting that. And they do that suckling pattern where they're a little bit of filling, suck, 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 pause, suck, 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 pause, and then they come off, and then you might not fill in the other breast, and then they do the same again, suckling. Very important that they do that. And that's the first reliable sign. The second reliable sign is that your baby pees regularly. And in the first day it might do 1 pee, the next day 1 or 2 pees, and so on up to day 5, and by the time they get to day 5 they should be doing about 6 pees a day. That tells you that what goes in is coming out, and the first thing is that their kidneys work and they start to pee, and that's a direct response to the fluids that they're getting. So look at their wheeze, make sure that they're doing the right amount every day, and if you're not sure how much they get, talk about looking at maybe putting a tablespoon in the early days into a nappy and feeling how heavy it is, and then as the days go on to day 5, put 2 tablespoons of water in a nappy and feel that. So you can feel about what you're expecting to get your baby, to get from your baby with a pee, and it should be pale and it shouldn't smell, you know, just you're aware that it's wee, but it shouldn't smell and be concentrated. And there shouldn't be anything in that looks like pinky brick dust, which is the urates we call them, and that's just the bladder flushing everything out, the crystals, the urate crystals out, and they shouldn't have those after day 4. So if you see those in your baby's nappy, you need to call your midwife after day 4. So on day 5, 6, 7, if your baby's got urates and your feeding isn't going to plan, and if you think your baby's not suckling and swallowing either, you should be calling your midwife. The next one after that is poo, and babies poo every day. Every day they poo until they're about 6 weeks old, and whatever happens they should be pooing every day. So if you're giving breast milk, they should be pooing every day. If they're formula fed, they don't always go quite so regularly, but if they're having breast milk exclusively, they should be peeing every day. And whatever anyone says, they should be peeing every day. So the poo should be the dark, sticky meconium, and then on day 1, it'll start to be less sticky but be dark, and then it'll get paler, and it'll become greeny brown, and then eventually it'll become yellowy green, and then it'll become yellow. And it's that dark, bright yellow like scrambled egg, and that's in your book that you take home with you. Off to the best start.
I was just about to say, you should be picking this up at your 36-week appointment when you come in for your scan. So when you come in for your routine scan, your growth scan at 36 weeks, they've got copies of these. Please ask for your copy when you come for your 36-week scan, so you can have a good read before you've had your babies.
And your baby's poo should be changing, and if your baby hasn't done a poo on day 3 and your feeding's not going well, then you should be calling a midwife and talking to them and saying, my baby hasn't pooed and they need to come and look at you feed, or invite you in for an appointment to look at you feed. If they say babies don't poo every day, it's normal, it's not. Babies should poo every day. So if they're not, if you're not getting the right answer, call us on the infant feeding team and we can talk to you directly, and we can just check what's happening. But every baby should poo every day. There's no excuse. If it's been breastfed, it has to poo every day.
I think you have to remember that breast milk is a laxative, so, and particularly colostrum, so babies that are not pooing are not constipated. That does not happen to babies that are breastfed. If they're not pooing, they're not getting enough food, full stop.
And be very assertive if you feel that you've listened to us talking and you've been told that it's normal for them not to. It isn't. They need to poo. So make sure you do contact us. We can't say that enough, as you've probably just guessed. So, make sure that you get help. Make sure that the volumes you're giving your baby, if you can't breastfeed or attach your baby at the breast, you're increasing the volumes. That's the other important thing to say. The first day you might give them little tiny drops, but as the days go on, by day 2 you should be increasing the volumes that you're hand expressing, so that, and you should be seeing your baby swallowing a little bit more, and your breast should start to feel a bit fuller and a little bit warm and veiny, and you should see changes in your baby, and directly the suckling and the swallowing will tell you that. You'll see heavier wet nappies, and the baby's poo will start to change colour. That's without seeing a drop of milk. If your baby's on the breast, those things will happen if you can't see milk. But if you're giving milk expressed by hand, then you should be increasing the volumes every day so that your baby gets more each day, and getting help to do that is really important if you're struggling. And by day 3, when your milk is transitioning from colostrum to mature milk, then it's what we call transitional milk, then it's something that you could look at as possibly introducing a pump if you're still struggling, but try and get help as well. To make sure that you're doing everything right and that you can get support to feed your baby. The very last one that we look at is your baby's weight, and they should be gaining weight every day, not being weighed every day, but their weight should go up consistently from about day 5. Babies shouldn't lose weight after day 5, and that will come with the obvious signs that we've talked about. If your baby's suckling and swallowing, peeing and pooing, you don't need a pair of scales to tell you that the weight is good or bad. So look for those, and as parents you don't need a pair of scales at home. You can see those things and think, yeah, my baby's doing lots of dirty nappies, lots of big heavy wet nappies, there's lots of seedy yellow poo in the nappies, and I can hear him swallowing.
And your breasts might feel more comfortable afterwards as well.
Yeah, you'll feel that your baby's transferring milk, so that will help you. And the other thing is that this is your care plan. The numbers are all on the front, so if you haven't had your baby, you haven't seen one of these, but this is the numbers that you contact to get help, and it is to your area. But there are certain numbers on here that you can call 24 hours a day. One of them is Wallingford, which is open 24 hours a day. So if you're on that side of Oxfordshire, sort of Oxford out, then to the south, Wallingford is 24 hours a day. You can always ask a question, even if it's in the middle of the night. During the day, you can contact your own midwives, but after hours, you can contact them to ask for reassurance if you've got any concerns. The other number that you can ring after hours is the Horton Maternity, which is at the bottom. It's the midwife-led unit labour ward number, and they are also available 24 hours a day, and they can offer you breastfeeding advice, and that's if you're Oxford going north. So that's lots of questions that you know, availability for getting help if you're not sure. You also get a thing on the back which tells you your tick list. And the other thing that is in here, because this is yours as much as ours, is that you can see a tick box for the 4 reliable signs. Alex is twitching because there's lots of questions. I can see her legs are going, so I've got to shut up in a minute. But this is your 4 reliable signs, okay? So perhaps not the 4 because the weight's not on here, but if you tick all of those and it's green, then you don't have anything to worry about. If all your tick boxes are in this side when you're looking at them and thinking mentally, yeah, no, I'm not doing that, I'm not doing that, that's where you'll be, and that's when you need to be talking to somebody. So if you've got tick boxes here or at the bottom, this is before 72 hours and this is after 72 hours, and obviously things change as your baby gets older, then you need to be talking to somebody as well if you're not sure.
So it's page 10, I think, isn't it? 10 and 11.
It's got
Pages
green
10
and yellow
11.
stripes on it, and that's for you to look at as much as the midwives do it. And they should do this with you as well, but you can do it yourself.
I always say, if you're struggling in the middle of the night, you're thinking, do I need to phone someone?
Yeah.
Or if, you know, I know that a lot of you, obviously, you know, you're going to be there, you've spent time in the hospital with us, and then you're going home and your partner might need the reassurance. If you go through that and everything you tick is in the green, then you can say, I'm doing a great job. And if anything's in the yellow, you can say, okay, maybe we need to speak to someone. So I call it the reassurance pages. So anybody who's met me on the wards will know I say that's your reassurance. That's your, you know, tells you whether you need to get help or you don't.
And actually, you know, most people don't. That's the thing. But it's a reassurance that what you're doing is normal and what your baby's doing is normal, and that you don't need to worry. And that's your backup. And your hand expressing is your emergency care. So that's your go-to if you can't quite get your baby to feed. Once your breasts start filling, sometimes it's hard. They don't know what the texture of your breasts like because they've been a bit softer, and suddenly they're full and the baby doesn't know what's happening because they feel slightly different. Sometimes just gently hand expressing to get attachment, it helps with softening around the nipple area so the babies can get a big mouthful. And the other thing I'm going to say is that our telephone number, if you can't think where it is and you can't remember what we've said, where to find it on the website, is on this page as well, which is the one with the sort of care plans on it. So
page 8, I think, isn't it?
Page 8, yeah, and that's just there in very small print, but the number is here for you to look at, and it's also on this forum as well, on the OMVP site on our forum. So you should be able to get help, and you should be able to get help 24 hours a day, and you should be able to be reassured, and if you're not, then somebody will come and support you. If you can't get hold of anybody else and nobody's giving you an answer, then call us as well, we're here. But we're not 24 hours a day, but you can leave a message on our answer phone. If your baby's unwell, then you would go through the normal way, but if your baby's well and you just want to check something, then that's exactly what you need to do. Make sure you're looking at your baby's poos and wees. And increasing volumes. Right, I'm done.
So it's quite interesting. There's been some peer support going on here, which is lovely. So Charlotte had put up her question about, you know, bringing in formula, because she wanted to formula feed her baby. So then Louise put a question up saying that she was going to formula feed her baby and wanted to know about bringing it in. And so Charlotte's replied to Louise. So it's fabulous. They supported each other, which is great.
Well, I'm answering.
So actually, so for both of you and anybody else who is planning on formula feeding, then we do provide formula. So we will have it here for you if that's what you need to do. So we do provide formula within the hospital, so you don't need to bring any in with you. But just whilst we're talking about formula, just to reiterate things that we've said on this session before, that remember that every formula has to meet UK standards. So actually, you can buy the cheapest formula and it will be just as good for your baby as the most expensive formula. So they all will provide your baby with the same nutrition. So you do not need to spend any more money than the cheapest brand. Obviously, it's your choice what you buy, but you don't have to. So from the point of view of your baby, you will not be giving your baby a substandard or a not such good formula. They are all going to give your baby the same nutrition, so you could save those pennies and use it for something else and go and buy the cheapest that you can buy. Because there are a number of the big retailers around that actually make their own, and you don't have to buy a named brand as such. So it's a bit like going to any of the big supermarkets and buying their own brand thing. It's just the same. You will not be doing a disservice for your baby. If you're buying powder powdered formula, one of the things that we remind you to do is to think about tipping your tin on a daily basis, because the heavier particles in formula drop to the bottom of the tin on a day as the time goes on, like your packet of crisps. It's all down the bottom of the packet of crisps. So give your tin a shake on a daily basis, and that mixes it up much better, and your baby is much less likely to be constipated because it's a better mix of the ingredients. So thinking about that. And make sure that when if you are going to be formula feeding, that you have had a conversation with someone, one of your midwives, about how to make it up safely. So the water has got to be hot. It's got to be over 70 degrees to kill off the bacteria in the formula. And that you've been shown how to responsibly, or PACE we call it, bottle feed, which is a much nicer experience for the baby than when we've in the past seen babies that are flat on their back with the bottle up high. What we'd much prefer to see is a baby up and the bottle horizontal. It's a much nicer position for the baby. So what we don't want is babies like this, because they get a constant flow. We want babies like this. So we want the bottle horizontal. And because it's so important, that closeness and comfort of feeding, whether your baby is breastfed or bottle feed, keep your babies in close. Make eye contact with them, talk to them while you're feeding, and that is all really important for their brain growth, regardless of their method of feeding, because you're bathing your baby's brain in oxytocin every time you interact with your baby, whether it's a stroke, a chat, whatever. You are bathing your baby's brain in oxytocin, making your baby a happy baby.
And having fewer people doing it is very important for that reason. It's just that they get used to those two people maybe that are doing it.
Yeah.
Minimising the disruption and also the transfer of bacteria and things that other people will bring that aren't living with you all the time maybe. At this point you won't be doing it, but at some point in the future. We hope that you will be able to have other people in your house.
Yeah, we've been in breastfeeding care this morning, and it's amazing how many of you out there who've recently had babies whose grandparents, your parents, have not managed to meet your babies as yet, and that's so heartbreaking. I was saying, gosh, if it was my girls, I'd be so upset not to meet my grandchildren. Anyway, moving on, Carly Marie has said that she's planning to breastfeed. Do I need to bring formula with me to hospital before my milk comes in? Do I need to bring my breast pump? And when can I start hand expressing? Well, where do we start? Right, no, you don't need to bring formula milk in, because we're going to assume you're going to breastfeed, and if you can't breastfeed, we would probably make donated breast milk available, because that would be the next choice. So we have donated milk in this hospital, we're very lucky, and that keeps your baby human milk exclusive.
Or express colostrum first, so you'd express your own colostrum first, and then you would be offered donor breast milk if you were struggling, and then formula last. And
although your milk hasn't come in, you have colostrum, and that's all your baby needs in the first few days of life. And we talk about milk coming in between 3 and 5, days 3 and 5. That doesn't mean your baby's not getting anything. It means your baby's getting colostrum, which is the most fantastic first food. It is chock-a-block full of every single antibody your body has ever produced in all your life. It's got all sorts of properties that protect your baby. It's amazing. So when your baby is born, the stomach is the size of a tiny marble. So we're talking really small amounts, which is why we use syringes to collect that thick, gloopy colostrum, which is a bit like golden syrup. And you wouldn't want tablespoons of golden syrup, teaspoons of golden syrup is all you need. And by day 3, the stomach has grown, and this is when the milk is beginning to start coming in. So the volumes that the baby needs is going up, and your production is going up. And then by the end of the first week, we're getting to a much bigger stomach size. But the milk production, as long as you've asked for it, has carried on meeting the baby's needs because you've asked for it. A milk supply is driven by milk removal.
And you don't need to fill that space, remember.
And you said you need to bring your pump in. Well, when it comes to expressing colostrum, because it is thick and gloopy and in very, very small amounts, we hand express, and we'll often hand express into a syringe because that's what we've got here, but if you happen to be at home, it could just be into a teaspoon. It doesn't need to be a syringe. So I hope I've reassured you that no, you don't need to bring anything in with you, and we will support you and provide you anything you need if you do need something else. That you will have something to feed your baby because you've got colostrum, and it's the best food your baby can have. It's the most amazing transition for a baby when they're born, and that if you need to be hand expressing, we will support you with that, so you don't need to bring your pump in. And if you want to express before you've had your baby, because you asked when would you start, if you want to learn that skill beforehand, Some mums will choose to have a go at it at about 37 weeks. So you could have a chat with your midwife at any of your appointments and get them to show you, or you could have a look at the Association of Breastfeeding Mothers or La Leche League, who both have fantastic online resources explaining how to hand express and when to do it. So you could have a look at that. So if you wanted to do it before you have your baby, but there's no obligation to do so. So have I missed anything on that?
It's a skill to learn. So a lot of mums find it much better to learn to hand express before they have their baby, because they're not tired, sore, distracted, and they've got more time. So you know, you don't have to collect the milk, you don't have to harvest it, but you might want to practice hand expressing, and that might be while you're having a lovely soak in the bath or in the shower. It doesn't matter, but you know, you might find it helpful to learn the skill before you do it, because it is a skill. It's not difficult to do, but it is a skill and it's a technique, and it's really important that you do it properly, because if you don't, it doesn't work so well. I could just quickly go through that, couldn't I? Have we got enough time?
Yeah, we've got a few questions lining up. But
so with your breast, you want to just stimulate it a little bit, so it'll be massaging it slightly, kneading your breast a little bit, something like that, just in a warm area, private, where you feel comfortable. It might be after you've had a shower, it might be while you're in the shower, but you can massage all around your breast as you're doing that. And then you make a C with your first finger and your thumb, and then you go to the base of the nipple and go about 2 to 3 centimetres, or an old-fashioned inch I suppose, from the base of the nipple back, and you can feel the texture in the breast changing. It's a bit like broccoli florets. It feels a bit sort of busy in there, and there's a lot more going on, particularly in a pregnant breast, because it's much more engorged, and your breast should have got a little bit bigger towards 36, 37 weeks. You might find that your breasts have got a little bit bigger. Not everyone's, but you might find that you start to get a tiny bit bigger again. Some mums might have leaked a little bit. That's normal. So it's also normal not to. So you know, just you might be aware of little crusty bits coming out, or a little bit on your nightie in the morning.
It looks like dried sugar, doesn't it?
Yeah, it's very sort of crusty, crispy, and clear. Sometimes it's pinky, but normally it's sort of a yellowy, cleary colour, isn't it? All different colours. Sometimes it's a little bit green as well. So you know, everyone's individual. With your C-shaped finger and thumb, then you want to sort of push back slightly against the chest wall, and then I'm doing it so you can see me, and then hold and squeeze, and you're using this finger and this thumb together. You're not using this bit of your hand, so it's not that bit of your finger, it's the ends of your finger and your thumb, so it's like a crab. Push back and hold and squeeze down. Release after about 4 seconds, push back, squeeze and hold for about 4 seconds again, and you get a little rhythm going, and you might see some little tiny blobs coming, you might see nothing, but get that rhythm going, and then move around your breast like a clock face. Now, some people have got a little sweet spot on their breasts, and they know where that is. They find that when they're expressing, and they get much more in one area, and then you get the idea, and the technique will come, and then you might start to see it dripping down, and then you might find that you want a bit of help, or you can use the syringe sort of backwards, or a spoon or anything, and then collect the drips on with the syringe on the end of your nipple, or collect it up as it's dripping down. You know, it does help if you have a baby and you're doing this, and this is afterwards, to have your baby skin to skin, but you need to work around it and get right around your breast, and then when you've finished, then you go to the opposite side. You're doing your massage in the same way on the opposite side, and then you do the same with the expressing. When you've finished that one, you've worked all the way around, you go back to the other breast again, and then you go back to this breast. So make sure that you you know, work both sides at least. And if you're doing antenatal expressing, then you can do it about 4 times a day before you have your babies from 37 weeks. And then when you've had your baby, if your baby's not attaching, then we would expect you to do it about 8 times in 24 hours in the first few days, and then you would go on further if you're still struggling, maybe to use a breast pump if it's appropriate. But there's no point using a breast pump in the early days because the volumes in your breast is so small that it just sticks to the side of the funnel and it doesn't go anywhere, and you can't collect it in a syringe even then.
Well, it's so sticky, isn't it? It really is like
really very sticky, and your fingers get a bit sticky when it trickles down and what have you. So, and it's very sweet. So
that's important because it's for brain growth. So your brain needs lots of sugar. A baby's brain is growing and using tons of sugar. And actually, human milk has got the most sugar of any milk. Any mammal milk has got the most sugar because our baby's brains grow so much. You know, we don't need to be able to stand in the first hours of birth after like a cow or a cat or
high lactose, isn't it?
Yeah, and we don't need to double our birth weight in 4 days like a seal. So you know, from that point of view, the main important thing for our babies is brain growth, and that's why our milk is so full of sugar for brain growth.
Really important. So you know, get on it and don't dilly-dally. If you've had your baby, then you need to do it yesterday, not tomorrow. And I say that every week. Do it yesterday, not tomorrow. Don't put it off, because you'll come back to us in clinic with no milk and say, I wish I'd done it before. And that time is gone. It's very time critical. So you get on it the day you have your baby. If your baby's not feeding well, get on and do it for your baby by hand expressing, because the bonus is, if you do that, you get colostrum out, you can feed your baby and you can stimulate your breasts as well, and then you don't worry about your baby not getting enough milk. So early days, give lots and lots of express colostrum if the suckling isn't as frequent as you're expecting, and if you're worried that your baby's not feeding much because it's very sleepy, you might have had a cesarean or a long labour and you're tired, so your baby's tired, then do that for your baby. And then, you know, we always say, if you've got milk, you can do anything. If you haven't got milk, and it's so hard to feed a baby when you've got no supply. And every mum that's listening that's been there will be shouting at the screen saying it's true. It's absolutely true that, you know, you have to be on it.
Yes, I think we talk about it every time about building your supply is time critical. We haven't got much time. You have to lay your foundations in the first few days, up to the first 2 weeks. Your baby can learn how to breastfeed, and it's a learnt skill for both you and your baby. And your baby may take longer. Some babies take longer to learn, but as long as you've got a milk supply, you've got a choice. If you haven't got a milk supply, then actually in the end, your poor baby, it's not actually, you know, it's not in their interest to breastfeed. So yeah, so really getting a supply is really important.
Yeah, you can't say that enough. Can't say it enough.
We've got hello from Marion, who's from Chinner. Get on Chinner. So we've got Brackley, Chinner, what was it, Fritwell. So Imi's come on, she's one of our regulars. She says, hello Alex and Naomi, hope you're well. Still exclusively breastfeeding, Leo's nearly 6 months. We knew you could do it. So just to remind anyone out there who's listening for the first time, you know, the recommendation is 6 months of exclusive breastfeeding. That gives your baby the best health outcomes. It's just exactly what the baby's body is expecting, and it sets them up for their lifelong health. We're not talking about just a year of age. We're talking about you know, their 30s, their 40s, their 50s, their 60s, their 70s, their 80s. Being breastfed will have make a difference. So well done, Imi. It wasn't easy in the beginning, but you and Leo have done an amazing job. Keep going.
And some of the benefits or the advantages of giving breast milk in the early days is in You're Off to the Best Start. I shouldn't say benefits because it's normal. So they're in here at the beginning of your booklet. They talk about the benefits to you as a mum as well, that will benefit you. So heart disease, ovarian cancers, breast cancers, and osteoporosis particularly.
Cardiac disease,
diabetes. Like, gestation, if you're gestational diabetic, if you breastfeed after you've had your baby, you're much less likely to go on to develop type 2 diabetes when you get older. So that's very protective for you. And also, if you do breastfeed, they know that mums have got 2 inches less belly fat after they've fed their babies. So if you stand sideways, you've got 2 inches less fat on your tummy than if you don't breastfeed. So that's very beneficial as well. So keep your trim.
But that's what's also protective about from the cardiac illness.
The heart disease, because your waistline is much smaller. So that protects you. And I think in America it saves about 14,000 people's lives, women's lives a year from heart disease and heart attacks. So it has a massive impact on cardiac health.
Right, Amy has put quite a long message up, so bear with me. She's due in 4 weeks with her second baby, and with her first she was induced early because of preeclampsia, and her milk supply never came in despite numerous attempts to try. Well, that's really tough. This time I've been closely monitored due to her history. However, been told they will allow her to go naturally if all goes well, so go into labour naturally. I really would like to try and breastfeed again this time, but worry that my milk won't come in again. Is there anything I can do to help this? Thank you.
Everything we've just said.
Skin to skin.
Protect your milk supply. Yeah.
Yeah.
Really early skin to skin,
So,
as soon as you can.
So Amy, we're doing quite a lot of antenatal appointments. So, you know, when I say appointments, they're telephone or video. But actually, we could have a chat with you about that. I think that you would be a perfect candidate for a conversation on the phone. But the first things would be lots of skin to skin, maybe doing hand expressing before you've had your baby, and you know, making sure that you get really good input right from the beginning. But I think it would be well worth getting in touch with us, Amy, and one of us will have a conversation with you on the phone, go through what happened last time, see if we can preempt it and make sure it doesn't happen again. We've been doing a lot of this, and we're talking to a lot of mums who've had troubles before, and it just means you go in to this next you know, sort of lactation, birth and lactation, with a more positive frame of mind, knowing that actually we've got to put a plan in place, you've got the support behind you, and the likelihood is it will work. So Amy, I would say please get in touch. If you're an Oxfordshire lady, then just give us a call, and we would be more than happy to have a chat with you. You know, 4 weeks to go is perfect timing. It's about now we talk to people. So please give us a shout, Amy. Marion has said her baby's 18 weeks exclusively breastfed. She'd like to introduce him slowly to formula, but he doesn't like it. Can I mix formula with breast milk to get him used to it? Oh, you see, breast milk's so lovely and so sweet.
Very sweet. And different texture, I think, as well, isn't it?
Yeah. I'm not sure about mixing it. We don't normally suggest mixing it because we're always trying to maximise the milk that a baby gets. But
have you tried someone else giving it? I think sometimes that's the first go-to. Offer it from somebody else, not from you. And maybe try giving breast milk in a bottle first. If he takes a bottle, maybe that's already happening. But in the bottle that you're going to use, or the cup, or whatever you're using to give him the drink, you know, offer him with breast milk and see if he'll take that as well that way. It might be that it's not the food in it, it's the bottle that you're giving that's the problem. So try giving breast milk in the bottle first, and then look at introducing the formula, but trying somebody else to do it. And if all else fails, you could give a tiny little bit of breast milk with, you know, a small amount in a bottle, rather than using a lot of breast milk and it getting wasted. Express a little breast milk with the formula if you find that that's what you'd like to try. I mean, there aren't any rules here, and we certainly know that if you give breast milk with formula, it does help to digest the formula in the baby's tummy, so that is always a bonus. If you're topping your baby up for any reason with formula and you're giving tiny bits of breast milk, that's a bonus. So it won't harm your baby if you do that. It might mean that they get used to it, but what you don't want them to do is go off everything if you mix it up and they don't like that taste either. So I would try just giving breast milk in whatever you're going to use and see if you'll take it that way with breast milk first, and if that's the case, then it might be that what you're using and change to a different type of bottle, or get somebody else to give it.
Yeah, I agree.
I think if he's hungry enough, he'll take anything eventually, but some babies just won't even accept a bottle when you've done 18 weeks of breastfeeding, because they love it so much.
They just like being there.
But it's hard if you have to go to work.
Yeah, it is really hard. And it's one of those things, you know, they love that closeness and comfort, and it's more than just the food, it's more than just the milk. There's so much going on. But many mums find that what they'll end up doing is they'll feed morning and night, and you know, if they've gone back to work, that works really well for them, and just keep that bit of breastfeeding going is really lovely.
But don't spend a lot on expensive things that are closer to breastfeeding, because
they're not like breasts.
You know,
they all advertise it, don't they?
They're bottles with teeth, so you know, that's all they are. They're not going to be closer to a breast than anything else.
And think about what we talked about earlier, having the baby fairly upright, the bottle horizontal, just making sure that the teat that's in the baby's mouth is full, but not the whole teat. It doesn't need to be the whole teat, because it allows the baby to pace their feed. Because if you think about it, when a baby's at the breast, they feed and take milk in their own time. Whereas with a bottle, certainly if it's upright, it will drip, 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 and the baby can't control it, and that actually is quite frightening for the baby. And they're having to learn a different way of feeding. So making sure you have your baby nice and upright, and that you keep that bottle as horizontal to the ground as you can. Oh.
Good luck.
Yeah, all the best, Marion. It's so
really
hard
because they do love breastfeeding so much. Many babies. Some babies don't care, but some are really fussy.
Yeah, really. Charlotte's come back and said one of her friends has had a baby that's born at 31 weeks. So it's not greatly well. So your poor friend Charlotte, I hope she's got lots of support, and I'm sure you will be a very good support to her too. And she's come back saying that she's using one of the supermarket brand formula milks, and that she's very happy with it as well. So that's an endorsement from her. Emily has said, if I hand express and freeze colostrum from 37 weeks, do I bring those syringes with me to hospital when I go into labour? Or we cover this nearly most times. It's a really good question, Emily.
Isn't it?
Yeah, that's a really good one.
Yeah.
You're going to go for that one?
So we don't want you to lose it or to defrost it, because you don't know how long your labour is going to be in, and we don't have on-tap freezers here. So if you're in one area and you get moved and they forget to get it in the hurry, then people won't know who it belongs to, and it may get discarded or put aside for one reason, and then you can't use it. So I would say keep it in your own freezer, depending on where you live. I mean, if you really want to, bring one syringe full in, and then you've got a little bit there, but your partner could always go back and get some more if necessary. So the idea is that you hand express and you get more out, and you've got the skill, so use the stuff in your freezer when you get home, and then keep hand expressing here. If you're struggling to hand express because you're not very well, then get your partner to drop it off, and they can it can be collected from the front desk, and then you can give it there. But don't bring it in when you're in labour, because it might defrost, and then you have to throw it out after 12 hours, isn't it, when it's defrosted? Yeah. So it's no good, and many syringefuls have been thrown out in the past for that very reason, because it's been put into a cool bag and it doesn't last for very long. I think really, really good cool bags with really good freezing blocks can last for 24 hours if they're never opened, but actually we say about 8 hours. So you know, don't lose it.
Yeah, I mean, it's one of those situations, if you're coming in for an induction of labour, how long is a piece of string, we just don't know how long the labour will be.
And express for you, while you're waiting to go into an induction, get another collection.
If you've got risk factors and you want to bring a bit in, as Naomi said, we'd be saying a really good cool box, lots of ice blocks, because once defrosted, it has to be used within 12 hours. Even if it goes in the fridge, it still has to be used within 12 hours, because it loses some of its protective properties from being frozen. So if you've got some that's recently done, then actually, and it hasn't been frozen, it can be stored for up to 5 days. So I would almost say a cool bag with recently done, it would be better, and just bring in the smallest amount, and partners can bring more in, as Naomi's just said. So much as it's great to have a store, we'd rather you don't lose it, and we'd rather that you're actually still doing it. So getting that skill is the most important thing, unless you've got a risk factor with your baby.
And if you express it in the hospital, it can be on the side for 24 hours, remember, if it's colostrum. 6 hours for breast milk, but 24 hours for colostrum. So, you know, hopefully your labour won't be more than 24 hours, and you can use it in the early days. The early day when you've had your baby, and you can give it a little bit of extra food, but you still need hand express, as Alex said. You still need to be on it and protect your supply. You know, it's all the same, yesterday, not tomorrow. You've got to keep doing it, because it's the number of stimulations all of the time that produces the milk. It's not what you get out, it's the number of stimulations. And that's the thing that raises your prolactin levels to make the really good supply of milk when you need it.
So I hope that answers your question, Emily. Amy's come back and said thanks so much, so hopefully we'll hear from Amy. Emily said, same Emily? Yes, same Emily. She said, is the ability to breastfeed milk supply genetic? My mum really struggled and had to switch to formula, and I'm worried I'll follow suit. There are genetic components, but we know that, because we see it with mums who have a difficult time the first time and then do brilliantly the second, we know it's much more than genetics. We know there's a lot to do with how it's dealt with in the beginning. So this whole thing about driving your milk supply. A mother who may have struggled the first time, and this is why we want to talk to people like Amy who said she had a problem. You know, actually, if we can get on it and really be proactive, the likelihood is most women will be fine.
We assume you will all make milk unless you don't. We will assume you will make it.
I remember when I was doing my training, they reckoned in the total population, there was only about 2% of women who actually couldn't produce milk. Now, we know there are certain risk factors, so if you get involved with us, we will reel off a whole load of things and say, does any of this affect you? Because they might be risk factors for not producing enough milk. But it's very rare. They're not common risk factors.
No.
So we anticipate the majority of women, way more than the majority of women, if they are proactive and get their milk supply going, don't have delayed skin to skin, get on it with hand expressing for the baby separated from them, and they will produce enough milk for their babies. So much as there can be a genetic component, it isn't just that. There's a lot more going on, and I think there's a whole generation, Naomi and I, sort of, you know, are aware of it. You know, the generation of our mothers, so born in the 60s and the 70s, the mishandling of mothers when they just had a baby meant that most women in those days did not produce enough milk. I'm not suggesting for any 1 minute that your mother's of this age, because I doubt it very much. But we know there's a huge generation of women who really, really struggled because they were given incorrect support.
When I started being a midwife, and that was in the early 80s, there was everyone had sleeping tablets at night, so everyone was tucked into bed with their sleeping tablet, and the babies were all taken out of the rooms and they were given water to feed overnight, and then the mums had a lovely night's sleep and the babies were brought back into them. And then they fed sort of 10 minutes each side. So you can see that everybody was very engorged and they didn't produce enough milk because they spent 12 hours of the day not feeding their babies, and the milk is driven more with prolactin levels, and they're very fluctuating in the 24-hour clock. So if you're not with the peaks and troughs of the stimulations of prolactin levels, then your supply goes down. And if you don't do it in the first sort of 14 days, which is our time critical time, which is what Alex talked about earlier, no matter what you do, it doesn't come back. You don't make that milk. So it might be that the way that people breastfed, and your mum breastfed and was told to breastfeed, and she had a good sleep at night and felt rested and went home after 5 or 6 days, you know, she had 5 or 6 days without feeding at night, and that meant that she didn't put her order in. And that was the do it yesterday, not tomorrow bit. You know, it's about putting the order in, and if that didn't happen, that may be why it wasn't necessarily going to be a genetic reason. It's often just the way that we did breastfeeding in those days. So, you know, if you're an 80s baby, certainly early 90s, it might be that, you know, that was the tail end of that. And so it might be nothing else. There are mums, and we've had many in clinic, and we've had a busy morning in clinic today with, and there are no answers sometimes why some mums don't produce milk, and it's heartbreaking. They do everything right, and sometimes they don't produce it, and there's no risk factors at all, and it's heartbreaking. We don't know. We haven't got enough answers to a lot of the things that go on with breastfeeding still, and we're starting to look into it in lots of different places. So, you know, we assume you'll make it unless you don't. So we just say protect your supply, keep going, lots of stimulations, breastfeed, 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 and we assume that your milk will come in at the right time and your baby will get enough with the good support that you need. So I hope that answers the question.
Yeah, so
We've always got a lot to say about every question, haven't we?
Emily, I think positive. Try and be as positive as you can. Access all the support you can. You can give us a shout. We'll talk to you as well. You know, there's Oxfordshire Breastfeeding Support, Abingdon Baby Cafe, La Leche, and it is a case of really making the most of all the support that's out there and making the support. You know, making the most of the support in the hospital. Don't go home on an early discharge. If you've got any concerns, do not be that woman who goes home on a 6-hour discharge. Stay in, get the help, then go home when you've got a bit more confidence in what you're doing and what you're looking for.
In that time, it's 2 or 3 more than you'd have if you went home and didn't have a breastfeed. So, you know, get all the help you can get.
Marion's come back and said thanks a lot. Amy's come on and said, just out of curiosity, what's the average weight for a 4-month-old breastfed baby?
4-month-old.
Well, we'd have to look at centile charts. If you look in your red book, go and have a look at your red book, and you will find the centile charts at the back.
Yeah.
And then there's the boy page and the girl page. And take yourself up the 4 months, and you'll be able to look at the 50th
line.
The 50th centile, and that will tell you. I can't tell you off
I've
the
got
top
a red
of my
book
head.
here.
No, I was going to say if we have
How
one.
long's a piece of string?
But remember that the centiles, you've got, because you have to, otherwise it wouldn't be an average, you've got people right at the top on the 98th, you've got people right at the bottom on the 0.4th. So for instance, my baby's always sat down under the 0.4th because my children are really small.
Mine were always on the 98th.
So there you go. And they've all grown up into perfectly confident.
And they were tiny babies, 6 pounds, so...
Yeah, mine was 6 pounds as well, so there you go.
Yeah.
So mine grew slowly, and Naomi's grew very fast, so it's very different. Have a look at the centile chart, back of your red book, look at the page, boy or girl, and go up from the 50th, so go up to the 50th from the 4 month, which will be 16 weeks. So work your way up. Draw a proper little, mark on it. That will be what you'll be looking at weight-wise. So have a peek and see. But as I say, it will vary greatly. It depends on you as parents. It depends on where your baby was born. How the feeding's going. There's so many variables. But have a peek at that. That's the best place to have a look. But a good question. We've never been asked that
I
one
think
before.
my babies were 14 pounds at 4 months, so you're probably horrified when I say that, because that's quite fat. But I've no idea what, there is no answer. You look at your line, so that, that's not at all average. That's just what my babies did. So look at what your baby's doing, and is it plotting on that line? So there isn't an average. No baby is average.
No.
They're all absolutely fabulous.
Charlotte's come back on and saying that one of her friends is having a baby, having been unwell, and that how excited they all are, and that's lovely. Congratulations to her, Charlotte. Emily's come back and said, that's great, you've made me feel much more positive. I'm already leaking colostrum. There you go. So we'll start collecting at 37 weeks. And fingers crossed we'll be all okay to continue when baby is here. If you're already leaking, that is such a good sign, Emily. Anyone who's not leaking, it is not a bad sign, but that's just reassuring for someone who's feeling a little bit concerned. But as I said, don't rush home. Please, please don't rush home. I know it's hard that you're here on your own, but you know what? There are other women in the bays with you. We come round and meet you, all of you, and someone will come and talk to you about feeding. So make the most of the help that's available before you go home. Please don't rush out.
And if there's any whiff of problems, let's see if we can get you feeding before you go.
Yeah, absolutely. Maisie said, how much will a newborn normally feed in formula? Because we talk about stomach sizes, we tend to say no more than 30 mils when it comes to formula, and that's actually quite a lot. We certainly would not be giving anywhere near that if it were colostrum, because colostrum is a food in concentrate.
I didn't see them.
Yeah, so these were the stomach sizes that we held up earlier. So this is a newborn baby's stomach, it's absolutely tiny. This is a 3-day-old baby's stomach, so it's got a lot bigger, and this is a week. So they've gone up lots. So drop them back in there. So we anticipate that a newborn baby being fed formula would be offered in the region of up to 30 mils and no more. The bottles that we have here, they're all pre-made. They're 70 mils in a bottle. We do not want the baby to take a whole lot of that. They would feel so uncomfortable. And we expect babies to feed. In the first 24 hours, they may only feed 3 or so times. In the second 24 hours, 5 times. But thereafter, we expect all babies to be feeding, on average, a minimum of 8 times in 24 hours. So if we go back to thinking about if your baby's not feeding, that's how often you need to be expressing. You would need to be expressing a minimum of 8 in 24 hours. So thinking about your baby, with regard to formula, it would be up to 30 mils for a newborn baby. And then that's going to increase, because as we mentioned, the stomachs go up, and the baby will look for more. But the first 24 hours, no more than 30 mils of feed.
I take if your baby doesn't have any medical problems and doesn't need, specific amounts of food. So just build it up very slowly. So tiny bit on the first day, on the first feed, so that they get used to it in their tummy. If you give them 30 mils on the first feed, they'll probably be sick, because it's quite a big amount when you think that you just get tiny drops of colostrum in the syringes. I can't find my syringe anymore. It's disappeared into the edge of my bag. When you think about the 0.1, so 30 mils is 30 of these syringes. So there's a lot more, and we were saying just give that little tiny, just that one little nick to a baby that's getting colostrum. So if you give 30 times that, that's quite a large amount on day 0. So just small amounts and build it up slowly so your baby's tummy gets used to that volume slowly. Because what you don't want them to do is just vomit all the time, because it just makes a mess, and it's, you know, worrying for you then, and
not very nice for the baby,
yeah, not very nice for the baby at all. So, you know, just small amounts and build it up, and then they get used to suckling, and they get used to feeling that, you know, the fullness in their tummy.
Amy's come back. I like Amy's comment. She went, "Thank you. Totally forgot about the red book chart. Homeschooling brain. Thanks." Well, good on you, Amy.
So sad for you all.
My hat off to anyone who's homeschooling. I have to say, I think I would have had irreparable damage with my relationship with my children if I'd been homeschooling them. I take my hat off. We had a mum in the first lockdown who had 2 boys, and she had twin girls. I'm not breaking confidence because I'm not telling you more about her, but she was trying to homeschool her 2 boys, and she had 2 newborn baby girls, and I did video calls with her helping with feeding, and oh my word, she deserved a medal. She really deserved a medal, absolutely. So I take my hat off to any of you out there, Amy, you know, you and any of the others. So no problem, have a look at your red book, which best bet.
Keep your babies tucked inside for as long as you can if you're homeschooling.
Yeah.
Schools might be open then.
Right, Nancy has said, sorry if we've already answered this question, we haven't today, so I've read ahead. Where can I get information on donating breast milk to the JR? I needed it for my first baby who was 10 weeks premature. My second's gone full term. Well done. And she's breastfeeding so well, and I have an ample supply, so I would love to donate if possible. What equipment do they provide, if any? Well, we don't provide any equipment, but you will be given bottles, so you can have the bottle. You'll get the bottles. Amanda Wood is the coordinator of our milk bank, and you can find all her details on the Oxford University Hospital's website, the OUH website. So if you go onto the website and put in Human Milk Bank, it will all come up. So there are forms on there that would need to be completed. You would need to have another set of blood tests, which your GP should be prepared to do. And tell them what it's for, and it's the same bloods you had at the beginning of your pregnancy, so it's just ruling out all those things they ruled out before, and then you need to disclose if you're taking any medications, and then they ask you to actually just be a bit more careful with hygiene than you would have to be for your own baby, because of course, as you know, it goes to premature babies first, and then if there's any left over, we can use it on the wards with our babies, on term babies on the wards. But what they ask you to do is to sterilise your equipment, make sure your hands are clean, do a little bit more hygiene sort of routines than you would if you were only doing it for your own baby, because your bugs are fine for your baby, so because you provide all the... So it's just thinking about that. But contact Amanda Wood and she'll fill you in, and she'll be absolutely delighted to hear from you.
Did you say blood test as well?
Yeah, I said the blood test. Yeah, it's the same. Yeah, so the same one that you had at the beginning of your pregnancy. So Nancy
GP might do it.
Yeah, the GP should do it, and because it's for the milk bank, there's no charge for having it done usually. So contact Amanda and she'll sort you out. And you can have a look at the forms online. But she'll be absolutely delighted to hear from you.
We always want donors.
Yeah, we almost really can't ever have too many.
And actually, if you think about it, you know, those of you who received your milk, donor breast milk on the wards, was given to you as a gift from other mothers, and they've all sat and pumped for you. So it's not just off the magic donor breast milk tree. You know, they've actually sat and pumped and given it to you with love. So, you know, when you do come in and you need it and you're trying to build your supply up, we normally say you pump as well to support that, so that you can match and try and make up what you're getting, because they've worked very hard to give it to you, and they often have given it to you because they've come from somewhere with their experience in the past and they want to give back. So, you know, it is a lovely gift that they give, and so we do like you to pump as well. We expect you to do that in order to, you know, to support the donor breast milk that you get, so that you can gradually build up and make your own supply to give your own milk to your baby eventually, and get home, which is really important, and the exclusive giving breast milk.
Final thing I didn't mention is actually they pick the milk up for you. They, the people who,
courier,
it's courier service. So the people who pick up the blood, the blood that people donate. So they're usually chaps on motorbikes, actually. I presume some ladies on motorbikes too. They will come and collect your milk for you. So there is a system in place. So you get provided with bottles and it's picked up for you. And they pick it up frozen. It then comes in and it's tested. It's bacteria. They do a bacteria count. It's pasteurised as long as it passed the bacteria testing, and then it is tested again before it's given out. So it is very rigorous. If any of you are offered donated breast milk, we do have a very rigorous system in place. So I hope that helps. And
how are we doing? We're nearly there, aren't we?
We are.
That's
A couple more. Maisie's just come back to say thank you. I'm glad that helped. Claire has said, hello, Florence was born in September at the JR and is doing really well. She's 20 weeks now, still waking every 1 hour 15 at night to feed. I'm so tired, I'm not surprised. Any tips for gently reducing night feeds? Not night weaning, of course, but just getting her to go a bit longer between. Think she may be snacking in the day as her older brother is so much fun to watch. Thanks so much. And that's where I was going to go, is just try and fill her up a bit more in the day. So.
Yeah, and of course if you give it to her at night, and she's just having a quick snack and falling asleep, of course she'll want it. Who wouldn't want their mummy's breast at every hour and a half in the middle of the night in the snuggle? They get wise to that and they love it. And babies that do wake up before 6 months need milk at night, so they should be getting milk at night if they're waking up. But is she meeting her milestones? That's the main thing. Is she gaining enough weight, and is she doing her poos and pees normally? It might be that she's heading slowly towards solids, and it might be that she's getting there, and just keep going for a little bit longer with what you're doing if you can. But if you can get more in the day and make her feed a bit longer, maybe go into a quieter room.
I was just about to say the same thing.
They do rub a neck a lot when they've got distraction, and it might be difficult for you to feed when you've got another child in the room making a lot of noise. But
entertaining older brother.
Yeah, it's making sure that they have a proper feed when they are feeding in the daytime, so that they get their calories in. And it's very quiet, and she's probably feeding that much in the day, and so it's normal for her. And as I say, who wouldn't want their mum every hour and a half to have a cuddle? Absolutely. If you do it, they'll do it. So but try and get more in, and do a few compressions in the day if you when you're breastfeeding, to see if you can get a little bit more into her when she's feeding, if she's doing quick short feeds at this age, which is exactly what they do at 5 months.
Claire's come back.
Every corner.
Claire's come back. She's gone, hang in there then. Yeah, I think if you can, just try and get some more food in the day in your baby Claire. They need an amount in 24 hours. So if she's so distracted in the day because of her energetic older brother, then actually it will have an impact on the evening. So yeah.
So compressions are to as far back to your chest wall, away from your baby's mouth. Hold your breast and squeeze when they suckle, and when they stop you let go. So it's not pumping, it's holding and squeezing, and they get a bit more of a hit, but it also stimulates more letdown, so they get more milk, and that might just be better.
Roll on 6 months, she's written now. We're with you there.
She's probably jealous of her brother if she's watching him all the time, because he's probably on steak and chips, isn't he?
Yeah. Right, Charlotte's just come back again. And she's just said how wonderful everybody's done. She says, we just want to say congrats to all the babies that gave birth in lockdown. I think after all of this, there'll be lots of people partying with their lovely new babies.
Definitely.
Yeah. Rita's come back, and Nancy, has come back and said, thank you, I absolutely want to pay it forward. Yeah, wonderful, thank you. And we're so grateful to anyone who donates. Yeah. And I think it's such a fantastic thing to do.
Please come forward if you've got lots.
Yeah, so Nancy, that would be lovely.
I think we got 11 litres donated, didn't we?
We did have 11 litres donated recently, so it's been lovely because we've been able to use it for our community babies. So, actually sometimes we're able to help bridge a gap when a mum's milk supply has been built up, so it gives her a little bit of time, so we don't have to break exclusivity, because as we've said many a time on the sessions, maintaining exclusivity gives the babies the best health outcomes. So keeping babies on human milk for as long as we possibly can, and for lots of reasons, but yeah. Anyway, I think that's us. Charlotte's just come back going, lockdown babies are us. Yes, you are. And there's quite a few of you today that have been with us a long time, Amy and Charlotte and Imi. So
our loyal fans.
Yeah, we'll get you badges.
Keep us coming back.
Yeah. Actually, just to say that next week we've got some meetings, some very important meetings about the service that we're offering. So we're not actually going to be running next Thursday, but think of us as we're being assessed. So yeah, so we will be having a week off next week, and we'll be here the week after. But thank you all for all your wonderful messages and all your lovely questions. They were fantastic. Thank you very much.
Don't hesitate to call for support or use OBS. We haven't talked
I
about OBS
I've mentioned
much,
OBS. I have mentioned them. They have been
OBS,
mentioned.
Breastfeeding Support, La Leche League, and also the Baby Cafe in Abingdon. So there's 3 really good local resources that are free to you if you need support as well, and they support you in your home in the fact that they're doing lots of Zoom contacts with you face to face, so you don't have to leave your house, which is great. Yeah, have a good week. Is that everybody?
Yeah, I think so. I've done all the questions. If I've missed one, I'm apologising. I have scanned up and down. I think I've got you all. Oh, Charlotte's going to miss us next week.
And thank you for your support.
Yeah, thank you very much, one and all. And if we've said get in touch, please get in touch. Give us a call. We can hopefully allay your fears and put a plan in place for going forward.
Yeah.
Right, you happy to turn off?
Yep. Bye for now.
Bye.